I'm going to ask, I've been getting suggestions from people in the audience, so I have taken 2 of those suggestions. And I'm going to ask 2 questions of the entire panel. They don't have to answer, but if they choose to, they'll have the floor. So the first question is, since they've been at the entire workshop yesterday and today, what insights did they gather that might impact the directions or work of their particular area of involvement? So I'm wanting some integration from what we've heard throughout the workshop to particular programs. Whoever wants to go for it, go for it.
Well, Susie, I can jump in and start. One of the things that I find really interesting in some of the conversation that even on the panel this morning is that dietitians in general are becoming much more aware of the issue of food waste, and it's becoming a more prevalent topic of discussion within our profession. I think retail dietitians can be a great inroad for programs like yours on in working with retailers on how do you get that produce from them. I think it's about systems being put in place, but I think it's important to consider retail dietitians as an inroads into retailers because they care about the issues. So I think there's good opportunity for partnership there.
One of the things that really just hit me right in the head today was the fact that we can identify earlier. So within our clinics, do we ever ask the question about food insecurity or hunger or your last meal or anything that would help give us an indication? I know there's screening tools and we don't know about them. So I think for me, being able to access those and bring those into our clinics would be a great thing.
And I think over the last 2 days, I've really solidified more how we've gone from just feeding seniors and vulnerable, but to looking at how can we impact their health and give them better quality of life. And for us, that's a critical, and as we struggle with all the different DRI and nutrition recommendations that were made yesterday, what is that best diet? Because we have to address so many of those individuals.
The thing that struck me most over the whole 2 days was the word community, and the power of the community, and you know, at risk of upsetting the federalists. I mean, you know, yesterday we heard all about, well, we can't get more money for this, we're not going to get that. To me, I think there's a tremendous opportunity there. I'm not sure I know how that applies to, you know, to sort of the product development part, the food industry, and whatever, but I mean, I think if I think of the food industry usually works with its community as part of its philanthropic, you know, local citizen. I think maybe there's a different model mindset that needs to be thought about, is how do we take that and build that as part of our business? Because I think that, you know, when you hear what we're talking about today, community is probably the one key success factor.
So I was really personally excited to get a wonderful education from a fair amount of you yesterday on DRIs and what really more complete nutrition looks like for seniors. I will say admittedly and candidly that I'm challenged by the information that I took in yesterday, as I imagine a fair amount of us are, in that there's a real reality of life. And so if seniors aren't presented either through mom's meals or other different menus with ease of access to more complete and regulated nutrition, how is it that we work to ensure that they, not only get a similar education that is easily digested and understood and know how to apply it, but that how do they really get that more wholesome nutrition? Because to be fair, for low-income seniors in particular, they don't have a lot of money, and we don't always know that they're going to eat a complete meal. They'll eat what they have access to and what's easy. So I struggle with, you know, what do we do about that? I also struggled with the fact that, in truth, this information is powerful, but advancing awareness and sharing that information is what's critical. And so I started to think well about what are the mechanics and avenues by which we share that information, not only for seniors. Somebody said this morning, let's not only think about sharing it when they get to be 50 plus, but what about before, right? Because you want to make sure that you're, doing preventative disease management before people even get to 50. So for example, I'm 40-something, and I'm not sure I knew a lot of that information or that anybody ever took the time to share it with me when I go for a well visit. So there's probably lots more I could say, but.
My comment will build on some of these other comments, which is that I am a huge fan of policy solutions to making healthier dietary intake an easier choice for people. But the truth of the matter is that all the work that really impacts people is based on local programs like we just heard about, and people's passion and time and expertise in their community. And that doesn't come cheap. It does take investment of time and money. And there is a lot of heterogeneity across the country. There are many communities for which there is a lot of food resources and help for food insecure seniors. There are also lots of communities where that doesn't exist. And I think we really need to be spending time and energy helping those communities that don't have existing infrastructure to build their programming so that we can reach people who are not otherwise being reached.
Situations like this, I'm always looking for replicable models and new types of partners. We are a very small organization with very big dreams, very big plans, and but actually very small. And I find out through our community and the church, all of us are the consumers in that at the church diner, while my whole program is trying to provide healthier food. I find that the customers aren't wanting to buy some of the food that we say is healthier, and I'm also trying to run a diner that's sustainable. And so looking at ways we can partner with people that have that information to create that in a more palatable way, to look at ways that will make that more desirable, get the information out to them, and replicable community models that have been successful at that.
Thank you. I'm going to ask one more question. Then I'm going to thank in advance those people like Robert Post who are using the microphones on the side of the to ask their questions. So you're next, Robert. But this is a question for the whole panel to consider. What would you say is the next big initiative for health and wellness in your area? And if there is a partnership that would help with that, what might that be?
I'm sorry. Specifically in health and wellness, I think the one I touched on in my presentation is probably the one, and it's already there, that's protein. But related to that, and perhaps ultimately maybe having an even bigger transforming effect, is something that I'm seeing in my supermarket and has been touched on in several of the presentations today. And it's that, you can go in a supermarket now and it isn't just, the processed foods in the middle, the fresh foods around the outside. It's the eateries, the places that are preparing foods that you can buy separately, take home, assemble, cook, or pre-cooked, or even pre-cooked meals. And that whole area is just transforming the supermarket scene. And, I kind of think that we're going to see that grow, but also we're going to see that get delivered to home. And I was just talking with Beth afterwards that, to me, the future for her is probably Amazon and drones. And whether it's Amazon, whether it's drones, whatever, but whether it's UPS, I think we're going to see an enormous change in how people are getting their food. Unfortunately, it's one step even further away from, buying the ingredients, processing, cooking, but that's the way of the world. And it's relevant, I think, to almost every age group. And it's probably going to have a pretty transformative effect on the food industry, which is already going through incredible transformations.
For the Little Clinic and Kroger, I had mentioned in one of my slides that we are going to be hiring more dietitians. So We will be hiring a lot more dietitians into our clinics, so they will be part of the healthcare team, working both with our clinics and with our communities and within the store and then within our health system partners. So we're very excited about that. And then as far as Kroger, looking at the fact that, again, with people coming into the grocery store 2 times a week, that having the pharmacy services, the dietitian, the nurse practitioner, and the food, and looking at how do we work together within the store for the health and wellness of the patient. And we're always looking at trying to help make it simple. So it is complicated in terms of, and then what works, what's going to help someone change behavior so that they choose that food, that better for you food. So I'm looking forward to the work. I mentioned our consumer insights company, and then the work of our health professionals within the store to be more personalized and also more helpful in the health and wellness field.
And for us, we really see is, again, how nutrition is going to come into the medical equation through either care transitions or chronic care management. And I think there is a big opportunity, because I think that's the next group of vulnerable seniors, those who go home from the hospital. They aren't mobile and they don't have consistent caregiving. In addition to those chronic care seniors, with the explosion of chronic conditions, that quality of life eroding, and how do we prevent that and do that in partnership, as you were asking. I think CMS has to be involved, and I think they have to look at it differently as a support service. I've been talking to AARP, who has access to these seniors, and some of the health plans we actually currently work with, doing the clinical studies to prove that that will make the big difference and bring down healthcare costs.
Just a couple remarks on this front. One is that the Affordable Care Act requires that medical institutions come up with a very deliberate plan that's approved by ACA about investing in their communities, particularly around health and wellness and preventative care. So we've seen a bit of an explosion, at least in the New York City marketplace, on what some of our larger medical institutions are afoot doing in communities. So I suspect we'll continue to see more of that. And then I'm having a senior moment. Happens, right? So there's that. And then on the insurance company side, and at least again in our marketplace, we've seen an increasing groundswell of folks who are there because there's competition to sign up a senior client base. But they're also doing a fair amount of wellness and education. So I suspect we're going to see more of that. And then finally, at least on the City Harvest side, as I mentioned briefly earlier in my presentation, we're busy noodling on how we might work through FENI grants and the USDA to pilot a program around incentivizing use of SNAP for increased purchase of fruits and vegetables, and hopefully consumption since they're purchasing it. There's a great organization, if you're not familiar with them, called Wholesome Wave. And Wholesome Wave does a fair amount of testing on these types of programs in the retail space, I believe with Kroger, actually. So. Oh, somebody out there said it's our program? Oh, yeah, hi.
So healthcare, the potential partnership and the emerging partnership between the system of food banks and food pantries in the U.S. and the healthcare system is a big area of interest and growth. I think that when we're talking about the healthcare system, we're talking both about payers, both public and private payers, and also individual clinics, where the opportunities for collaboration are really huge between a food pantry and an individual healthcare provider who can partner together to ensure that that patients/clients have access to the food that they need to manage their chronic disease. I was gonna add on to something that you said, and I'm having that loss of train of thought too.
Passing it on.
That's right. So I'm gonna come back later and share that thought with you. The system of food pantries in the U.S. is, first of all, extraordinary in its scope. There's about 58,000 Feeding America food pantries in the U.S. But if you think about where they are located in the areas of highest need. In low-income neighborhoods, in neighborhoods that reach many seniors, often actually in buildings that are for senior housing. And so this creates an opportunity to reach people in their communities in a place that they are in many cases very comfortable going. They know the volunteers there. In many cases, the pantries are open at a time that's already worked into their schedule. Chronic disease management is very challenging from a healthcare perspective because it requires interaction frequently. It's hard to go to your doctor at the academic center on the hill once a month and pay for parking or walk in the full block from the bus stop. But food pantries are often right there, and people are primed when they walk in the door to talk about health because we understand food so much in the context of health. That's a really important opportunity, and one that I think healthcare providers and healthcare payers are increasingly recognizing.
I'm going to try not to do a whole lot more things. We're about doing all we can do, but work on doing the things that we do, doing them better. Certainly want to continue to work towards striving for everyone to have a place at the table. So looking at the Double Bucks program with SNAP recipients and the senior match and increasing that, getting better funding for that so we can provide that for more people. As many folks have talked about on a variety of levels, we've done a really good job at creating access and reducing barriers, but it's that piece of increasing desire that's the key part, the knowledge and the desire to want to eat that. And I'm kind of flipping your question to say, one of the things we always look for as a small organization and as a church is capacity from the medical field and the researchers and all of that. So I would encourage folks in those fields to look at area churches and food banks and food pantries, places like that. Churches are often places where people trust, and it's a great place to have a potluck dinner. So what a better opportunity to have food that you enjoy, to have people gather together for social interaction, and to be able to work on some of those ideas. So I think the community level at the simplest level is really key, like getting clinics in grocery stores, like having dietitians at food pantries, but also working with the small groups where the energy is already there in communities to provide some of this knowledge and access.
Robert, your question, we only have time for 2 quick questions. I apologize. Robert, you're first.
Sure. Is this on? I know there's a challenge to deal with November through February, in some cases, especially where fresh produce is a really large component of the program. And understand too that food insecurity versus healthy and trying to merge those two is obviously a key. So what do you do with other foods beyond produce? I mean, how do you build in access to frozen or to canned or dried or other forms of food to meet the nutritional needs and deal with food insecurity and the healthfulness of the foods that you have in the various programs? And I guess this is Leslie and others might be able to answer.
I will say from our perspective, the canned is easy. Frozen requires investment in infrastructure that pantries have not even fresh produce, have not traditionally had. So you have to have freezers at your food pantries in the church basements. You have to make sure that your food isn't delivered on Monday for your pantry on Friday if it's fresh produce. These are areas of really important consideration and infrastructure development. And I think in terms of meeting the health needs of food insecure seniors, it's really important that we continue these initiatives to make sure that these foods are available from food pantries across the U.S.
Not to cut it off, but I'm going to take the second question.
Thank you. Vera Zaransky with AARP Foundation. So one thing that struck me throughout all the presentations was there's always the slide linking food insecurity with mental illness, and particularly depression, which seems to occur in the majority of food insecure older adults. And there is a screening tool for depression, which is a validated tool, the PHQ-9, and certainly as depression is a debilitating chronic condition on its own, it influences the onset, progression, management of all these other chronic diseases, which you're already addressing. And so I'm curious, is anyone already implementing the PHQ-9? You're interfacing with older adults in so many settings, in their homes, at the farmers markets, at the pantries, and is anyone doing that? Are you addressing mental illness in any shape or form? I would just love to learn about that, or if you're exploring doing so in the future.
We talked earlier, so I have a little bit of an advantage, but I'll say this. It's something that doesn't get nearly enough attention. At City Harvest, I'm busy leading our program team through what's called a theory of change that will lay out the foundation for our next 4 to 5 years of programming in healthy neighborhoods. And one of the things that we're talking about is acknowledging what we're good at, but acknowledging that there are other folks within the landscape who can provide necessary resources that we can't, that address the whole person and not just food. So I suspect that we'll be thinking well about how to connect mental health providers and clinicians more closely with the work that we do and the emergency food network, so food pantries and soup kitchens that we serve. There are a smattering, not a large amount, but a smattering of the some 1,200 emergency food programs in New York City that don't only distribute food, so they address the care of the whole person. And so there is some mental health screening that goes on and follow-up support, but not nearly enough.
Thank you one more time to all of these excellent speakers.